Morning, everyone. Thank you for inviting me. Great to be in a room of harm reductionists. And I hope that I can offer a tool which we can have in our toolbox, and one which hopefully we'll be able to have more of as we move forward and in response to drug use in general, not just nitazines, but recognising that we want to engage with all people who use drugs and offer tools to keep themselves safe. So just a little bit about me, and then I'll move on to the Loop and what the Loop does. I'm a nurse, I'm a general nurse, and a lot of what Claire had previously said rang true in terms of my background as well. When qualifying as a general nurse back in '95, I moved directly into working in HIV treatment. And at that point, actually, unfortunately, it wasn't really treatment, it was end-of-life care. And we moved then to a space now where people are living with HIV. But at that point, we also needed to look at how we prevented the difficulty, the exposure to HIV and then death as a result of AIDS. And I moved quite quickly into needle exchange and working around needle exchange because I think often my approach is what can be done? What can we do in relation to this? And I think this is where the Loop and drug checking comes into play. And I've been with the Loop now for 2 years, and really it ticked a lot of boxes for me in terms of my background, in terms of working in harm reduction, and really taking on something which is a challenge to scale up. It is a challenge to ensure that we can do more of this in the UK, but it is absolutely needed. And I think, it's been an absolute pleasure to come into an organisation where we are doing something new, but we also have a body of research. And through the work that Professor Fiona Measham took on in starting the organisation, is that we can demonstrate the impact of drug checking. So the Loop as an organisation we describe ourselves, although the name says the Loop Drug Checking Service, we describe ourselves as a harm reduction organisation. We are informed, our harm reduction work is informed by our drug checking and our drug testing. And in some ways, that is the carrot that we use, in effect, to bring people in to engage in our services, and use that as a key aspect regarding providing accurate, clear information regarding how people might use drugs. We never talk about using drugs safely. We will always talk about there being a risk around using drugs, but we can give people themselves the tools to consider how they're going to use drugs and how they can reduce risk and reduce harms. And we do that through direct and indirect messaging. And I'll come on to a little bit to say what I mean by the direct and indirect. We also provide training as well. We have a huge team of volunteers, but we also recognise that actually we can have more impact in terms of harm reduction if we're also training various workforces around harm reduction. And that might extend to police, it might extend to local authorities, universities, but also people working within festivals and the nighttime industry as well. And we will go into different environments as well. We've gone into different events, festivals, clubs, and looked and conducted harm reduction audits, where we can see where some of the measures which might be in place to prevent drug use may also be increasing potential risks as well. So if we're talking about door searches, all of those sort of things which can reduce drugs being on site, can also drive behaviours around preloading and maybe heightened drug use and faster drug use, and really trying to think about what are those difficulties that we need to have to consider and those challenges in working with different partners where maybe we have different priorities regarding prevention, zero tolerance, alongside harm reduction as well. So that's much of our work, and I've also touched upon some of the research. And if you go to our website, you will see multiple papers that have been published regarding our work. So what exactly do we mean by drug checking? And you'll hear the term both drug checking and drug testing. We use those very deliberately. So drug checking is public facing, sometimes referred to as front of house, and where a member of the public can come and directly submit a substance that maybe they've taken some of that, hasn't been as expected in terms of the effects of that drug, or potentially they're planning to take some of that drug in the future, and they can come in advance and have that drug checked and receive then the results of that alongside and embedded within a harm reduction consultation, a brief intervention. And that's some of the work that Deb does, along with my other colleague, Debs, and Adam, in terms of delivering those harm reduction consultations. What is important is that we're able to test rapidly. So the Loop has a lab which it will take to various locations. I'll come on to the licenses that we need to have in place in order to do that. But we have a lab where we will set up the different analytical techniques that those substances will go through, predominantly FTIR, infrared spectroscopy, reads the compounds within that drug so that we can see what is in that drug. And then different aspects of the analytics, which will also give us some quantification as well. But we do that with a level of accuracy which balances alongside the rapidness of that. So if you are looking at fixed site lab testing, you may be able to get greater analytics, delving in much greater to what that substance is. But we balance that out across the engagement that we need with the individual as well. We need to recognise that someone is unlikely to come, maybe wait sort of hours in order to get that result. We're trying to turn this around quickly, because the important aspect of this is having that direct engagement with that individual. Essential to this is also working in partnership. We have to work with the police in terms of recognising that people will come to the service in possession of a drug. And it's really important that anywhere that we are operating our services, we have that partnership with the police. They are on board, with the priority being harm reduction in terms of the delivery of this service. It also is really important that we work in partnership with drug treatment as well. So our Bristol service has already been mentioned, and we're hosted there by BDP. Lydia is in the room, who has been a fantastic partner throughout the development of this. And that's really important as well, not only in terms of the trust and engagement into the service, but also thinking about the pathways that can be in place for people who then come, engage with drug checking, and then potentially need or wish to access further support. And we can do that direct pathway into further services. So how did we get here? So a little bit of history of the Loop. There's Fiona, Professor Fiona Measham. So you talked about pioneers. I would suggest that Fiona has been a pioneer in this space and has really pushed forward in terms of ensuring that drug checking is able to be established in the UK. It's not an easy journey. It's been stop-start, certainly since 2012 when Fiona was just first thinking about this. But even in the 2 years that I've been in the Loop, with the Loop, I think Adam described it once. He said, "Oh, it's been quite spicy since you started at the Loop," and that's been various sort of wranglings with Home Office to get us to having the first drug checking service in the UK. But we started out the work in festivals, and it is that recognition that festivals are often an environment where there can be increased drug use. Yes, less so heroin, crack use. Those aren't the sort of drugs that we are seeing in those environments, but we are seeing potentially more experimental, more risky drug use taking place within those environments. And it was also a space where we saw partners coming forward and saying, work with us on this. We're wanting to ensure that this is an environment which is safer for our audiences, and we're willing to test out, trial this in terms of what can be done. Again, alongside police forces, those that are licensing these kind of events and festivals, and particularly also the security, medics, welfare who are on site as well. So we conducted drug checking within a festival environment up till 2018. And that was always done with a memorandum of understanding with the event and also the police. But after 2018 testing, the Home Office said, I'm not sure that, well, they didn't say I'm not sure, they said you can't do this, actually. They said you can't do drug checking within this environment. And a Home Office licence will be needed in order to conduct drug checking services. At that point, we moved and went to back-of-house services. So back of house being where we are testing confiscations, amnesty that comes through and into those environments through the searches. And we're still conducting elements of that, particularly within environments such as festivals and large events and club venues as well. Now, again, I'll come on a little bit more to that. We had applied for a Home Office licence. We had said to the Home Office, OK, we won't do drug checking within a festival environment, but there is an importance to having this in the UK, and we wish to now conduct this within community spaces, within city centres. And that's still very much our direction of travel, and the importance of that being that also we're looking at wider access. We're looking at there being equity in terms of people who are using any drug being able to come forward and have their drugs checked. And you have to buy a very expensive ticket to get into a festival. There will be many people that we don't reach if we only provide services in those environments. So we'd applied for our Home Office licence. We had that in early 2023, and then we became a charity. Fantastic news, drug checking being recognised as a legitimate charitable activity. But that meant that we had changed our legal entity, and you can't transfer a Home Office licence to a new legal entity. So we had to reapply, and we reapplied in November 2023. Suella Braverman was Home Secretary. So there you go. Took us a while. So a year later, November 22 we applied. November 23 we got the licence and were able to start up the service in 2024, January 2024. So Bristol City Centre testing, once a month service, every last Saturday of the month, has now been operating since January 24. So why do we check drugs? Well, firstly, people take drugs. We need to have an acceptance of that within our society, and I'm probably talking to a room where there is that level of acceptance, but we know that that isn't across the piece. We also know that the drug market changes, and it changes rapidly. And we've heard about nitazines, but we also see this within the supply of ketamine, MDMA, cocaine. These are ever-changing drug markets. And all the time, there are people who are contemplating, coming to first use, and we need to make sure that we are informing people regarding what is in drugs, but also making sure that they can make informed decisions about choosing to take drugs and how they use those drugs as well. And the Loop's primary aim is harm reduction. In knowing about drugs, in knowing what is in the drug market, working with people directly to be able to take those informed choices. We always talk about this. We neither condemn nor condone drug use. We're pragmatic. It happens. And people require harm reduction information in order to make those decisions. And this would be the case, actually, illegal, or legal supply. We are likely to continue to need harm reduction information. And there's a quote there from Fiona, again touching upon that aspect that there will always be an element of risk, but how can we minimise that? So where are we at in terms of drug checking in the UK at the moment? We know that we had the drug strategy, came into being in 2021, calling for innovation to reduce drug harms. And that is exactly what drug checking is. It's a clear model, it's a clear response, which is innovative in introducing this into the UK. We know from our research that it leads to reduced drug use, it reduces polydrug use, and it has a lasting positive health impact. It also is universally applicable to people who are using drugs, whether that's in a dependent manner, whether it is occasional, whether it's at that point of contemplation as well, whether it's recreational drug use. And we know the word recreational was not favoured by the previous government. So the beauty of it can be that it can meet people, it can provide something at all those different stages, and also is applicable across all different drugs, as I've said. However, that wasn't fully recognised by our previous government. And so we have, to a certain extent, I describe it like delivering the service with one arm tied behind our back. Because whilst we received a licence for drug checking, it did come with a set of criteria. And that criteria is really quite hard to describe and explain, and we've done it many, many times. But in effect, what we have to say to people is that we can provide you with a test result if you meet a certain criteria in regard to your drug-using behaviours or the drug that is submitted to us. And in effect, and this is in order that we satisfy the previous drugs minister's position on drug checking, that it should be targeted towards dependent users. And this is defined by assessing when someone submits the drug, and it is anonymised, it remains anonymous in terms of using the service, but if they, on a very basic assessment, state that they're using that drug 4 days or more in a typical week, or if it's a drug typically used in a dependent manner, heroin, spice, crack, or benzodiazepines, or a further criteria that if on testing that drug, it is thought to cause significant public threat. So if we were to test an MDMA pill, for example, and it was found to have nitocene in it, or 2CB, as has been mentioned, then that would be deemed a significant threat in order to provide that test result. So you can see, just me describing it to you, how do you get that messaging out to the public? How do you say, this is a universal offer, please come use this? It perpetuates stigma around using services. And it means that there have been some limitations in terms of how we've delivered it. We did feel it was important to go ahead with drug checking even when having these restrictions. And fortunately, what we are also able to do, because we're known for our research and evaluation, is have that opportunity to go back to the Home Office, and we will be meeting with them on Friday in order to review this criteria. So it is a step forward. It's not where we want to be, but it is it's helping to make the case for why we need to go further, why we need to extend this out. And unfortunately, it is the potential of synthetic opioids in all drugs that is potentially going to get us there in terms of that expansion of criteria. It's not the reason we want to have to extend this further, but it is making a strong case for this being that universal offer. So these are the benefits that we are able to demonstrate to the Home Office. And we have our data from back in 2018 in those festival environments where we were able to see the behaviours that changed as a result of gaining information on the direct substance that was being submitted. That people were saying if it wasn't the drugs that they were intending to take, that they thought that they'd purchased, they would destroy that, and they weren't intending to go ahead with using that. People moderated their dose as well. And we're seeing some of this through our drug checking services in the community as well. It's lower numbers. It's very different coming to a service where it's in your local area, that you don't have that same sense of anonymity you might have within a festival environment. But we are seeing numbers coming through. We have seen heroin submitted to us, benzodiazepines, spice, ketamine, and particularly when there are concerns in the local area, and this is where it's really helpful working with BDP, they will be saying to people, yes, we've heard about the possibility of contamination within spice at the moment, or there was a recent issue regarding xylazine and ketamine, and that we see the footfall increase when there have been those concerns locally. We are seeing also people who are not known to services as well, and that again is one of the advantages of drug checking. Will draw people in who maybe don't feel as though other aspects of the treatment system meets their needs. And I think that's something that we all need to think about more broadly, about why are people not coming forward and into services and support. But we are seeing that people do intend to use the same dose. That's important to acknowledge that when working with people with dependency, it's less likely they're going to say, I'm going to dispose of this. But importantly, what they are able to do is get naloxone. First time I've mentioned naloxone, I think. But importantly, that is always available when we're delivering our drug checking services. So there is this partnership that means there's this wraparound harm reduction support. I'm going to move on. I'm conscious of... there we go. So what are we seeing? I had mentioned as well that we continue with our drug testing. So we've recently gained 2 further Home Office licenses in order to deliver drug testing within large venues. And this gives us all year round intelligence. So in the past, festivals would come to an end, and I would say drug use is not a seasonal activity. Festivals may end, drug use doesn't, and we need to continue. And we have been successful in getting those Home Office licenses for large venues, one in London, one in Manchester, that give us that context regarding the drug market. And this is really important. I almost describe it as breadth and depth. So our testing, our back of house, gives us that breadth of knowledge in order to be contextualised when we're seeing people through our drug checking services. So there is, in some ways, a need for both, because we'll always see a more select number of people really coming through and into drug checking. So it's a really helpful way that we can build up the picture. What we do see in our drug checking, though, is a much broader range of substances. So 20 plus different substances. Generally within our festival environments, we're typically seeing maybe 5 different substances. So much broader range. And I think what is important also to acknowledge as well is that we have seen the direct submission of a nitazene. We talk predominantly about nitazenes being an adulterant. We talk about nitazenes being an unwanted substance. And we need to be prepared that will probably shift and change. And so we need to be ready with the harm reduction information, harm reduction advice, to be able to provide people and meet those needs when people come forward and say, this is what I'm using, this is what I'm intending to take. And we need to be equipped in order to advise people accordingly. We also, within our drug testing, as I've mentioned, we look at the quantification as well. Really important when we are talking about MDMA and ecstasy as well. Again, we talk about the risks around substances, often about being it's something that is unintended or unwanted in what people are taking. However, a lot of the overdoses, a lot of the risks that we see, particularly within those festival environments, is not people taking something which is not as intended, it's taking too much of what they intend to take. And that's a really important message to get out to people who are using drugs. That it can be the substance you absolutely want to take that is going to potentially cause harm. And we see this a lot with MDMA, where we are seeing drug-related deaths within clubs, within festivals. Many are MDMA related, and it's the strength of that which is causing harms and causing risk. So I mentioned briefly about the indirect harm reduction. So alongside the value of drug checking being drawing someone in, we also know that there will be people who will never use a drug checking service. They don't feel able to in terms of maybe personal risks that they feel it's not for them. They feel as though in terms of their using at that point, they can't surrender any substances. They need those, they're dependent upon those. So our indirect messaging, our social media postings, the way in which we can disseminate information is absolutely critical in terms of reaching many, many people beyond just those that are going to walk into the service. I'm going to briefly just say about licenses as well and some of the challenges. We have, as I've said, we've had many challenges with the Home Office. However, we are in good conversation with the Home Office, and there is dialogue, there's communication about what we need to do, how we need to develop drug checking, and glimmers of hope around drug checking and the criteria for that being expanded. One of the key challenges, though, is Home Office licenses are site-specific, so anywhere that we want to take the lab, we require a Home Office license for. A license on a good run from application through to having that piece of paper in your hand will take 4 to 6 months, and probably more likely to be 6 months. Alongside that, we need to identify funding. And one of the challenges that I'm having at the moment is that a lot of areas, boroughs in London, different areas are saying to me, could we fund this through our underspend on our supplementary budget? But I have to spend it by the end of the year. I'm saying, great, yes, we could fund it in that way. You've probably got enough money to fund a drug checking service. But by the time we put in the license, we'll be into next year. And so these things do not align. And this is where we need those that hold the purse strings or those that have the regulations in place start to come together to look at that longer term funding. Year on year doesn't work for us, does it, all the time? We need longer planning. We need to be investing so that we can, and across financial years as well. So those are some of the challenges for us. But I think, there is opportunity here. This is innovation. There is a recognition that drug checking does work. Drug checking is needed. And we are in that place where we are now evaluating what we have done in Bristol for a further year, and there are multiple conversations about other areas needing to put this response in place. So please come and talk to me, work with us, and hopefully we will see more than one drug checking service in the UK in 2025. Thank you.